Ever wonder why some experience trauma but don't go on to get PTSD while others have their very lives ripped apart, wrenched from them, and simply choked out by paralyzing memory? The key to all of this might be resilience, preventing PTSD by helping people to develop one of their most innate, yet so often untapped capacities. With this in mind, we caught up with Matthew Friedman, MD, PhD, and expert in the field of trauma prevention.
Another factor that relates to the neurobiology of resilience is our genes. One of the things we've looked at is the allele. As you know, we have two copies of every gene. What's interesting is that this gene comes in two varieties. There's a long allele and there's a short allele. And that people with the long, in other words, two copies of the long allele, seem to be much more resilient or even resistant than people with the short allele. Having the gene itself isn't going to make you have PTSD or depression. It's having the gene and then being exposed to traumatic episodes.
And that's just a bite-sized slice of what we get into. And the news gets even better. We're interviewing 5 other trauma specialists, clinicians, and researchers whose experience in treating unresolved trauma gets into topics such as risk factors for developing PTSD, what we need to know about who is the most vulnerable, the neurobiology of trauma, a brief tour of what happens in the brain during stress, how to administer first aid for trauma, screening for PTSD, 4 simple questions. It's free to listen at the time of broadcast. You just have to sign up. Go to www.nicabm.com/treating-trauma to find out more about this call and other cutting-edge teleseminars in trauma treatment.